Hi, I'm Dr. Bashar Al-Naha and I'm the Principal Dentist of the Care Dental Practice and Care Dental Platinum in Hammersmith, West London. And I'm here as a dentist to reassure you, our patients, and all dental patients in general, that after the lockdown, our absolute priority is going to be your safety and obviously the safety of our staff as well. And there's a whole series of procedures and techniques that we're going to be employing after the lockdown to make absolutely sure that you're well looked after and that your safety is an absolute priority. So I'd like to take you through that journey of how things are going to be different and how we're going to make sure that you are 100% safe in this environment after lockdown. It's going to start with ideally us sending you all the forms that you need and all the correspondence that you need, like medical history and your complaints, and hopefully if you could take some photos of any concerns that you have and send them to us so that we get as much a complete picture as possible of your needs, your concerns, and your the problems that you're experiencing, as well as, of course, extremely important, your full medical history, because that impacts your dental health as well, and it impacts on the treatment that we might be seeking to provide. Having all that done, you book the appointment, and if you're coming by car, the ideal thing would be to stay in your car and we'll contact you when we're ready for you. Come in, you obviously have to, first thing you do is to sanitize your hand. We like to also take a quick temperature of you just to make sure that you're symptomless. And then after that, we give you a mask. And if you have to sit in the waiting room, we try and avoid you having to sit in the waiting room. We would rather you came straight into the surgery. But if you do have to wait in the waiting room, then we make sure that social distances is practiced, where you are at least 2 meters away from any patient in the reception area. There will be large perspex screens between you and the receptionist so that you are protected and the reception staff are protected as well. As you come into the surgery would have been totally wiped clean with antiseptic in all surfaces to make sure it's 100% clean. All instruments are fully sterilized in our autoclave that kills all bacteria and viruses. And in addition to that, as a result of our very special and high quality air filtration system, the whole of the air in the practice would have been recycled, and all bacteria, viruses, and any microbes would have been totally eliminated. So you come into an area that is totally free from any bacteria or viruses or any such microbes. Obviously, when you sit down, we as a dentist and nurse would have our full PPE kit of the highest caliber and the highest quality, the same as that's used in hospital intensive care units. We'll have a hat on to cover our hair. We will have visors. We will have a very high quality mask of FFP3 or even better, and then a full gown with obviously a disposable bib on top. When we're ready to start, obviously our particular technique is to make sure you as a patient are totally relaxed and comfortable, and we like to give you some relaxing air to breathe, which is a combination of a small amount of nitrous oxide with oxygen to allow you to feel very comfortable and relaxed, and we combine that with a relaxation technique that allows you to feel extremely relaxed and comfortable. And then any numbness that we need to do, we will do obviously totally pain-free, so that your whole experience as we proceed with the treatment is very relaxed and comfortable, and we absolutely guarantee that you do not feel any pain or discomfort. As far as payment is concerned, we try and make that contactless. If you do have to pay by card, we'll make sure we will wipe the card clean before we use it, and then wipe it afterwards as well and return the card to you. Preferably, we like to make sure that the payment is contactless, and sometimes we can send you a code where you pay over the phone, and that avoids any contact whatsoever. And we employ this level of cross-infection for each and every one of our patients. Obviously, we leave a gap between patients to make sure that we wipe all the surfaces clean and to make sure that there is enough time for all of the air to be circulated, so that the next patient that comes in a totally clean environment, free from bacteria or viruses or any microbes. This is the usual procedure for each and every patient of ours because of the degree of seriousness with which we take your safety. And so with all these procedures, we're more than happy to welcome you in an atmosphere that's guaranteed to be 100% safe for you.